If we talk about how people with blood cancers present to physicians or other doctors, blood cancers or blood disorders can increase or decrease your blood cell count. Particularly if it affects white cells, people can present with fever. White cells are very important in our immune system. With the blood cancer, your immune system can go down, which can expose us to infections. It is common people coming with infections or fever, cough, or skin infections. And also when the hemoglobin goes down, we feel tired or we feel not right. It could be anything, feeling lethargic, feeling tired, feeling exhausted can be a sign of or a symptom of a blood cancer. And also we have little cell parts called platelets in our body. With the blood cancer, they can go down, which can cause bleeding. So if we don't have enough platelets to control bleeding, you can have a hemorrhage. So some people can present with minor bleeds like bruises, that is a small bleed under the skin, or they can bleed when they brush teeth, or in rare instances they can even present with the more significant or a bleed into brain or into GI tract or your abdomen. Sometimes people come and ask why they have got a lump. Particularly in lymphomas, they can feel their lymph nodes and they present with lumps and bumps. And also a blood cancer can cause loss of weight or loss of appetite. If you have loss of weight without a reason, then it's good to see a physician. It may not be a blood cancer, it could be some other reason why you are losing weight, but it may be a symptom of a blood cancer as well. Sometimes they can present to other specialties, particularly patients with myeloma, that is a type of blood cancer which predominantly affect your bones, particularly your backbone. They can present with back pain. So they can go to orthopedic surgeon with a fracture or a broken backbone or back pain. Also myeloma can cause renal failure. So they can present to a nephrologist or a renal doctor with kidney failure or your kidney is not working. It is very important to see why the kidneys are not working or why your bones are broken. It could be due to a blood cancer. I'm telling this because if you diagnose early, these are very, very treatable and it is not going to cause a death. Also, some blood cancers grow so slowly, people might not recognize that they have a leukemia. Those are called chronic leukemias. They can present when they do a blood test for something unrelated to a cancer. For instance, if you do a full blood count because you have fever or anything related, that can show a elevated white cell count, which will lead to the diagnosis of a chronic leukemia. So those we call incidental findings. They are not particularly coming with a complaint related to a cancer, but they have done a blood test or a scan for something else which reveal that they suffer from a blood cancer.